and recognize Congresswoman Dingell from Michigan for her 5 minutes of questions.
Thank you, Madam Chair, and I want to thank all of the witnesses for your patience today, but also your testimony. I have to tell you that, and you can tell as members have been talking to you, that there have been patients that have reached out to us, told us their stories, and we know the trauma many of you are suffering from, of people even taking you seriously. Where do you go? How do you get support, etc. So what I have found very impressive in the testimony today and in discussions with other people is the patient-led research collaborative. The U.S. has unmatched research infrastructure, and we've started to advance patient-centered research through organizations like PLRC, but I'm really impressed with the ability of patients to self-organize around a new condition like long-haul COVID and get your voices together and to be effective quickly. And I think that's really important, and to get your results quickly into the medical literature. So I'd like to ask Ms. McCorkell some questions. Thank you for being here, first of all. Can you share more about the patient-led research group and how your team formed?
Yeah, and thank you so much for those really kind words. I completely agree with you that patient-led research is something that is filling a gap right now. So Patient-Led Research Collaborative formed back in April of last year. We just celebrated our 1-year anniversary, and it was after all 5 of the team leads, we all got sick in March and realized after a month that we were still sick. We joined the Body Politics Support Group, which has helped so many people just find a community of other folks who are going through the same thing. And we all have research backgrounds. Mine is in policy. And we realized that there was just so much information being shared, and someone needs to document it, because it was clear at that point, this was April of last year, no one was really paying attention to us. Doctors were gaslighting us. We weren't able to get tested. And the media at that point wasn't covering us either. So we put out a survey. We got 640 respondents, and that was the first research on long COVID. And I think that really helped to bring to the forefront of the conversation this issue and this illness. So that was a little bit about how we formed.
My next question is, how is your organization engaging with researchers at the NIH or with PLRC? How are we making sure it's coming together the way it needs?
Yeah, so thankfully, we've had a lot of outreach with different researchers, and there are definitely researchers out there that have that we've been in conversations with. We actually have applied for part of the funding that NIH is providing. So I guess we'll hear back from Dr. Collins in the next few weeks. So we've applied in partnership with other researchers on that funding. So, and with PLRC as well, we're hoping to do a project with them. So we are in communication with a lot of folks. I think our biggest hope, though, is that, you know, there was over 200 applications for this NIH funding, which is awesome. But our worry is that not all of them are going to incorporate the patient voice. Not all of them are going to incorporate past research into post-viral illness like ME/CFS. Not all of them are going to incorporate ME/CFS patients. And these are very critical in order to actually create findings that are going to be useful for long COVID patients.